Hi everyone, my name is Bernard Kofi Osei. I'm about to present to you what I did, the research I did about the Center for Specialty Care. Um, Before I begin, I gotta show you guys the topics, what I'm about to go over it. And I just want you guys to write down anything that you guys were confused about or as I go along. You can just send me an email and I'm ready to answer you guys. So first of all, I'll talk about the Center of Excellence. From there, I'll come back and I'll talk about Haywood Center for Specialty Care. From there, I'll come back, I'll talk about the vision, their mission, the values, and their services. From there, I'm about to talk about the strategies, tactics, the geography, the operational plans, and why Haywood Hospital, their specialty care is different from other hospitals. So what are some of your thoughts about Center of Excellence? I just go by saying what is the meaning of Center of Excellence to you, and why do companies or hospitals have to set up Center of Excellence? So before we talk about this, I want you to think about what do you think about Center of Excellence when it comes into your head? What's the meaning of that? And why do we really have to set it up? So I'm giving you guys like 30 seconds to think about it, and from there we just about to go from there. All right, so now I know what you guys think about what Center of Excellence means to you and why we have to set it up. So, to me, when we talk about Center of Excellence, basically it's something that we do to provide leadership. We do it for the best practice in the healthcare, and we do that for research, and we try to do that to support and train employees. So that's the main reason why we always have Center of Excellence. And I found a couple definitions online, and according to Mangroves 2018, she defines Center of Excellence as a research center focused on promoting best practice related to a certain healthcare conditions or topic. So for example of these conditions can be the Center for Specialty Care, the Center for Urgent Care. So any aspect in the healthcare center can be a condition that people can make their research on. And also, Mangroves also define Center of Excellence is a tertiary of healthcare provider organization that is identified as the most expert, cost efficient, and produce the best outcome for their program. So, like what I said, this helps a lot of hospitals to reduce cost for their patient, and then to identify a lot of the most expert in the field that they are doing. So, like I was saying, that I asked you guys a couple questions that why we have to set up Center of Excellence. So there are several benefits that the hospital and their customer is going to get from Center of Excellence. So the first one is going to be it's going to help to monitor cost. First of all, this is going to make it easier to control and track cost in the healthcare system. So when we have a Center of Excellence, it's going to help not just the customers, but the hospital as a whole to control and monitor their costs. And also, it's going to measure outcomes. The monitoring of this cost is going to help them to measure the outcome of what they're doing. And the last is going to help them. When they try to plan ahead of the programs that they have to introduce to their patient. So the next one is going to be flexibility. So having Center of Excellence in your organization, for example, in the specialty care, is going to create something. It's going to create a flexible working schedule for the employees and for the customers, which is the patient who will be coming for the services, and it's going to help to eliminate cost. So one can ask him or herself that how can Center of Excellence eliminate cost? That's going to be a very great question. But the best way it can eliminate cost is because the group of people are specialized to come up with a research in a specific activity. So they all focus on that activity they are doing. So it's not like they're just going to be a whole lot of different activities at the same time, and just paying attention to one activity at the same time helps to eliminate costs. So like I said, I chose Haywood Hospital Specialty Care. And a little bit history about Haywood Hospital is the hospital was established on June 27th, 1907. And the hospital was given to the community by Martha Haywood and her daughter. In 1921, Haywood added maternity and pediatric ward. In 1990, the hospital built a new medical office on campus. And in 2010, the hospital built its expansion ever. And they made this expansion, and they added emergency and acute care. So there's a little bit of history about the Haywood Hospital. So let's talk about the Haywood Center of Excellence. So it's not it's a hospital that they not just they don't just boast about just one center of excellence. They have various centers of excellence that they be working on. So the first one is Center for Specialty Care. So this was the topic that I chose to work on it. The second one is the Heart Center. The third one is the Imagery Center. The next one is the Haywood Rehabilitation Center. The next one is going to be the La Chance Maternity Center. So these are the Haywood Center of Excellence that they are practicing actually in the hospital. All right, so let's come back. We're still talking about Haywood Center for Specialty Care, and the hospital actually their specialty care offer a lot of advanced clinical care in areas such as neurology, endocrinology, pain management, and podiatry. And the Haywood Center for Specialty Care patients. So this hospital, the patient design allows patient easy access to adjust to support services, including financial services, lab, patient registration, and day surgery. So basically, what this Haywood Center of Excellence they do is they're just there to serve the community in so many ways. It's not like they're just there to make their own money. They're just there, they provide financial services and a lot of day surgery for the community. So now let's come back and talk about the vision of Haywood Specialty Care. First of all, their vision is to become the best independent hospital in the United States. That's their number one vision. They just want to be the best independent hospital in the United States. And their second vision is they want to transform specialty care. And the best way this hospital they can transform their specialty care is through culture, caring, safety, and quality services. This is another vision that the hospital is trying to provide for the people. So the next one is they just want to recognize their employees, the families, the volunteers in the community. And the last one is they just want to bring changes, not into the specialty care, but they just want to bring changes in the society. So it's not going to be like they just want to make those changes in the society, in the specialty care. But at the end, they want to make sure that those changes they bring impact the people in the society. So from vision, now I want us to talk about the mission of the hospital. So before we go back and talk about the mission of the hospital, I want to give you guys like 10 seconds to think about what's the best mission of every hospital. For example, if you own your own hospital, what should be the mission of it? What's your mission? All right, the 10 seconds is over. Let's see what you guys think. So their mission actually is to improve health of the community. That's their number one mission. So they're trying to improve this in a way that they can become the community trusted hospital. Okay, so by improving the health of the people in the community, it gives them the chance for the community to trust them. And also, they have a mission of making the hospital a diverse and inclusive place for not just the employees, but for all Americans. Let's come back and talk about the values of the hospital. So basically, the values of this hospital include compassion, attitude, respect, and empathy. So all what this value means to the hospital is to motivate the employees. Is to motivate the employees to give their best to the hospital and the community. And also these values encourage employees to create a nice working environment for themselves and the community. So the services that Hayhood Hospital offers include, like I said earlier, they have Center for Specialty Care. They have that kind of services for the people in the community and the United States. They have the Heart Center. They have the Hayhood Rehabilitation Center. They have the Behavioral Health, La Chance Maternity Center, Multicultural Services, Access Health Insurance, and Social Service. So they have a whole lot of services for the people, because their goal is to help the community and become their the trusted hospital. Now let's talk about some strategies. So there are so many ways that Hayhood Hospital attracts their customers. So some of their strategies is they just want to improve the patient experience, not just with the doctors, but their experience in the hospital. So they always work at their best level to make sure that their patients are having the best experience ever in the hospital. So the second one is, the second strategy that the hospital uses is they always measure and report quality performance, not just from the doctors. So the way they can just measure and report this quality performance is after the doctors, after you've seen your doctor, there's going to be a survey that you can participate in it so that they can measure how they are doing actually in the hospital. And the next strategy that the hospital is using that separates them from couple hospitals is they're trying to adapt new payments models. And the next one is the access long-term sustainability. So these are the strategies that Hayhood Hospital uses that put them aside from most of the hospitals. So now that we're talking about the strategies, I just want us to come back and think about some of the tactics that the hospital will be using. Not just the specialty care, but the entire hospital. So let's think about some of the tactics here. So one, some of the tactics they just want to use is they want to make sure that their patients are satisfied whenever they come to the hospital. They're certified in a way that the services that they receive from the doctors, the physicians, or the nurse practitioners, they okay with it. Another one is the hospital always devotes a meeting within every month to make sure that they are improving the patient experience. And the last one is they try to create insensitive programs for staffs based on increased referral volume. So these are actually the tactics that when you come to the Hayhood Specialty Care and the hospital, they use it. So let's come back to the geography part of it. So like I was saying, geography really plays an important role in the specialty care and in the hospital as a whole. So one would be like, what does geography has to do in the hospital? So first of all, we all know that specialty care and geography, they are intrinsically linked. And also, what I'm trying to say with geography has to do with healthcare, and specialty care is it deals with the interaction between the people and the environment. And also, geography helps the doctors. It helps the doctors at Hayhood Specialty Care to know the health information of the people that they are seeing. The people in the community, the people in the United States, and the people in this world. So geography actually plays a huge role in specialty care and plays a huge role in the healthcare system. So let's talk about the operational plans. How do the hospital operate? They have so many plans when they are operating. So Haywood Hospital Care operational plan ensure there would be continuous provision of care that would be guided by high quality standard. Also, their plan is to make it easier for the hospital to develop a healthy relationship. One of the operational plans is they have to have a quality relationship with the people in the community. And having this healthy relationship, like I said earlier, helps them to build trust with the people in the community. And the operational plans helps health professionals to become responsible at the workplace. So having these operational plans, it makes every employee at the hospital, not just at a specialty care, it makes everybody responsible. They know what they're supposed to do, what they are allowed to do at the hospital. So, why Haywood Specialty Care is different? There are so many things that make them different. But what I just want to talk to you guys about is their specialty care program strive to make their staff devote to making their patient experience as comfortable as possible. So first of all, what this means is they always want to make sure that their patients are comfortable being at the hospital. The second one is they try to do their best all the time to their patient. And it's not common to go to a lot of hospitals to see them doing their best all the time. But at Haywood Hospital, especially at their specialty care, they always want to do their best for their patient. They put their patient first. And the next one is they always work hard to make sure that the work schedule and they minimize patient wait. They're going to make sure that patients are going to come and they're going to stay for the longer time. They always have a lot of employees out there to make things go quicker for the patient and the company. And lastly, they make sure that all the patient needs are answered. Any question that you have concerning your specialty care that you want to talk to your doctor about it, they have people there who are ready to answer you. So this brings me to the end of my presentation. If you have any question, you can please email me, and I'm going to post this on my YouTube channel, and you can just give me a comment about that, and I appreciate that. Thank you. And if you have a question, just let me know. Have a nice one.